going, but I'm gonna wait for it to kind of.
Okay.
I'm gonna kind of wait for it to say it's going live. There we go. Okay. Hi everyone. Welcome
Hello.
to Facebook Live in O'Fallon. It's National Chicken Wing Day and National Lasagna Day. So if you don't have lunch plans, those are some options.
My name is Kristina Hiatt. I'm a second-year student at Missouri State University. Y'all already know Kinsey. Today we're going to be talking about prehab exercises you can do before you have a hip replacement surgery. So before we get started, we're going to kind of go over some goals for today. We want you to be able to do these exercises, both range of motion and strengthening. We want you to understand how to do them in a pain-free range of motion. And then we're going to kind of go over and help you understand positions you want to avoid after the surgery. So we're going to talk about the different approaches. You can have a posterior approach. This is the most common way. It's going to go through the back side of your hip. With this procedure, you want to avoid I'm going to stand up. You want to make sure you're not kind of crossing your leg over in front of your body. You want to keep your toes pointed forward, so you don't want to point it in. You want to keep them straight. And then you want to avoid kind of flexing your hip past 90 or bending over past 90. Another common way to do it, it's a newer way, is the anterior approach, and that's going to go through the front side of your hip. This is more popular now. I almost said common. Popular now because it has fewer precautions. With this one, you mainly just want to avoid laying on your stomach or extending your hip backwards, so like kicking out behind you. So now we're going to do some range of motion exercises.
The fun stuff.
The fun stuff. Okay, and we want to emphasize you want to do this in a pain-free range of motion because right now it's probably kind of inflamed. So we're going to start with a hamstring stretching. For this, all you're going to need is your bed, the floor, the couch, whatever's comfortable for you, probably not a recliner, and a strap. If you don't have a strap at home, you can use a belt or a long towel.
Dog leash.
Dog leash, that's a good one. All right, I'm going to have you lay on, I'll move this out of the way, handy dandy table. And for the strap, you just want to place it around the bottom of your foot so it's nice and secure. You're going to lay down, straighten your leg, keep your knee straight as you can, and you really want to feel it down in the back of your thigh. If you feel it more up in your calf, you can bend your knee, and that should isolate your hamstrings better. For this, you want to do it 3 times, and you want to hold each one for 30 seconds. Good. Another stretch you can do while you're laying down is, I'll take the strap away. You don't need any equipment for this one. You're going to bend your knee just like so and kind of let it fall out to the side. Good. And you should feel that kind of in like the front, right in like your inner thigh area. Yes. And if it's not stretching enough, you can do light pressure and press it down. I cannot talk today. And again, you want to hold that for 30 seconds, and we'll do it 3 times. Perfect. Another good stretch you want to do beforehand, you can do this standing at your counter, at the back of a chair, whatever's kind of comfortable for you. And you're going to stand. You can have a hand there for support. You want to put one leg out in front of you, and you're just going to kind of lean into that front foot, bending it. You don't want your knees to go past your toes. And you want to feel this stretch right in the front of your hip. And again, we'll hold that 30 seconds.
And for this one too, when you're doing it, when you're going forward, you don't want to make sure you don't want to like really lean forward or you don't want to really lean back. You just try to keep your upper body straight and then you just kind of lean forward.
Yes. And then from the same position at your table, at your counter, wherever, you want to face it. You want your feet a little over shoulder width apart. You're just going to lean to one side, bending again, making sure your knee doesn't go over your toes. And you're really going to feel it on the inside of your other leg. You're just going to bend over. And you should feel that stretch. Again, 3 times for 30 seconds each.
In the front view, so you can kind of see what she's doing. She's just, on this table, she's just kind of going like this. So she's staying straight. She's kind of going to the side, and it's going to stretch the inside of your leg. Just like that.
Yes. Another good thing for motion is if you have access to a stationary bike or a pool, that'll be good to kind of get some motion going through your hip, get it nice and fluid flowing in there, getting nutrients in there to kind of get some pain-free, non-weight bearing cardio exercise before we get into some strengthening stuff. So for these, we're going to show them with and without a band, like so. We're going to start on the table. You can lay your side. We're going to do, it's called a clam shell. And so for these, you want to make sure your knees are bent. You're going to keep your feet together. You want to make sure your pelvis is stacked or your hips are right on top of each other. You're not rotating back or rotating too far forward. You want to roll back like this. Yes. And then exactly like Kinsey's showing you, you just want to open up your knees, keeping your feet together. You should feel that right in your glute area. And this is your working your gluteus medius, and this is a good muscle for making sure you have stability, especially when you're doing single leg stuff, like when you're walking. To make it harder, you can use bands, and you just put it right above your knees.
So you're going to put the band right above your knees, and then you do the same motion. It's just with a little bit of resistance.
Yep. And for these, we're going to work our way up to 3 sets of 10. If you have pain, just do it up until the point where you don't have pain. So if she had pain right there at the top, you just go stop right below there and go back down.
Like this?
Yep. And then from that same sideline position, again, you can do this on your floor, on your bed, on your couch. You can bend this bottom knee if it's more comfortable for you. You can also keep it straight. It's your personal preference. Again, you want to keep your hips stacked right in line, and you're just going to lift your leg towards the ceiling. And you should feel it again in that same glute medius area. Good. And again, we're going to work our way up to 3 sets of 10. If this is too hard with gravity, or just another way to work this muscle in addition to, is if you're standing at a counter or a table and you're just going to kick straight out to the side. You don't want to turn your toes and like point forward. You really want to keep straight out to the side. You can do this with a band as well. You can just put it right around above your knees. Just kick. Working our way up to those 3 sets of 10 through that pain-free range of motion. And then we're going to lie on our back. And you're going to keep your uninvolved, unaffected knee bent, and you'll straighten your other one, so whichever one you want. Yep. And you're just going to contract your quad, lift your leg up to about the height. Yeah. Okay. Contract your quad, lift your leg up to about the height of your other knee, or whatever's pain-free for you, and then lower back down to the table. And you don't want to relax your quad until you're back down on the table. Good. And again, with this, we're just going to work our way up to 3 sets of 10 through the pain-free range of motion. From here, also on your back, we can bend both knees. And with this, we're going to do what's called bridges. So from here, you want to keep your feet about hip width apart, hands down at your side, and we're just going to lift your butt up towards the ceiling. So side view. Yep. And this is really good. It's working on your glute max muscle, and that's really good for extension, getting your hip back behind you, which is an important part of your walking pattern. Good. With these, we're also going to work our way up to 3 sets of 10. And then we want to do All right, now we're going to roll over onto our stomach. And what you're going to do is you're just going to lift your leg up to the ceiling. Good. And this is working that same big glute max muscle, helping us get that extension. You want to make sure you're not like trying to arch your back. It's not a huge movement. You just want to pick it up into the ceiling. Good. We're going to do 3 sets of 10 for that one too. Another way you can do that exercise is if you're standing again at the table at the counter and you're just kicking out behind you.
And then really make sure when you're kicking standing, you don't want to arch your back.
Yep. So it's not about how high you can get your leg. It's just you want to feel it right there in your glutes. So I'm not like going like that. Or just straight out behind you. And you can make that one harder with the band. You can put it around your knees. You could also do it around right above your ankle if you wanted to. And just right up behind you.
Like this.
And then another one you can do with the band as well. I'm going to show you. So you can put the band around your knees here, like so, and then feet together. You're just going to go straight out and back in. Straight out, back in.
Yeah. This is also a way to work out your glute medius muscle, the side one right there.
And then also, after you kind of complete those stretches and you complete those strengthening muscles, if it's sore or tight at all, a good thing to do after is always ice 15 or 20 minutes after your exercises. The band that we've been using, so really the only equipment that we've used through this whole thing is the strap. We do have the strap online on our Therapy Essentials, just on our website, the shop tab. We have the strap too, which will come in handy after your surgery as well. And then the only other thing we used was a band, just a resistance band. We also have that on Therapy Essentials as well. Different resistance. You can choose a light resistance, a medium resistance, a heavy resistance. And you can, all the exercises we did without bands, you can add to them once they're getting easy. You can add this as a resistance in order to make it a little bit harder. And then you can also, this band is going to come in really handy after your surgery as well, because you're going to do therapy after, and they're going to kind of, as you do your strengthening, you're going to be able to do a lot with this band as well. So you'll use it prior to surgery, you use it post-surgery. So this is another great thing. Also, I know it's almost the end of July actually, but our product of the month is a TENS unit. I know we've mentioned it every week for the past couple of weeks, but that's another thing you can use pre-surgery, post-surgery, after your exercises to kind of loosen up your hip muscles and help. You could do it with ice, you could do it with heat, you could do it without ice or heat. And you can kind of use that to help loosen up your muscles as well. So a lot of the exercises we do, pretty easy. You can do a lot of them with just body weight at home. And then if you only need a couple of things to make them harder, but even if you don't have a resistance band, you can kind of add reps with it. So pretty easy stuff to do at home prior to surgery. A lot of the stuff is pain-free as well. So like Kristina was saying, just kind of making sure as you're doing them, if it hurts, don't feel like you need to push through that pain. We gave you a lot of options for the exercises, so you can kind of choose which ones help or which ones seem to hurt. Don't try to push through pain or anything like that. And I think that is all we have for you today. So hopefully you have lasagna or chicken wings for lunch today, or dinner. That's true. And we will see you next week.
See you next week.
Bye.